Good evening, everyone. My name is Jason Morales. For discussion 3, I chose to work on the temporomandibular joint, which is located right here. All right, so here I have my unlabeled image of the articulating surfaces of the temporomandibular joint. We're gonna go ahead and start with the articular disc, located right here, followed by the mandibular fossa, right here in blue, the superior joint cavity, here in yellow, the inferior joint cavity down here, the mandibular condyle right here, the articular tubercle right here, the articular capsule, and the ramus of mandible right here. The TMJ is essentially the articulation between the condyle of the mandible and the mandibular fossa. So here we have an image of the requested ligaments reinforcing the TMJ, which would be the joint capsule up here, the sphenomandibular ligament right here, right next to the joint capsule, the styloid process on the outer layer, and the stylomandibular ligament down here. The TMJ is located anteriorly to the tragus of the ear on the aspect of the face. There are 3 extracapsular ligaments which act to stabilize the TMJ. So going back to my first image, the anatomical feature of the TMJ is the articular disc, located right here in the middle. The articular disc serves as a cushion between the 2 bone surfaces. The TMJ is a modified hinge type of synovial joint made of the condylar process of the mandible and the mandibular fossa of the temporal bone. And now I'm gonna go ahead and demonstrate the movements that are allowed in the TMJ. I'm gonna go ahead and start with the protrusion, which is basically an underbite. Retrusion is bringing it back in pretty much. Depression is lowering the jaw. Elevation, bringing it back up. And lateral deviation is a side to side movement. And that's it.